At the time of the revolution, Iran's literacy rate for citizens aged 15 and above was a mere 36%, well below the global average. The situation was particularly dire for women, with only 35% literate in 1979. Consequently, the Islamic Republic's first strategic move was a massive nation-driven mobilization of resources to achieve universal literacy. The transformation has been decisive. The national female literacy rate reached 74% in less than 2 decades and has since soared to 93.5%. In rural areas, the leap is even more dramatic, from a mere 4% to nearly 90%. This foundational investment in education created an entirely new societal environment, and all of this was done under sanctions and war. The principle behind educational justice also powered another of the nation's most dramatic turnarounds, its healthcare system. Before the revolution, deprived cities and villages often lacked the most basic public health infrastructure. To address this, the Ministry of Health and Medical Education was created to develop what would become one of the world's top national healthcare networks. As a result, infant and maternal mortality rates dropped at a stunning pace. The post-revolutionary era, with its focus on independence and state support, catalyzed a qualitative and quantitative leap. By the 1990s, 96 to 70% of the country's medical needs were produced domestically, up from a mere 25%. More than just generic substitution, Iranian scientists have entered the frontier of producing high-tech, complex drugs, positioning the country as a regional leader, a capacity that proved its strategic value under the most severe sanctions. It was this human capital, the generations of educated scientists, engineers, and pharmacists, that became the nation's ultimate resource when facing external pressure.